April, thank you first for doing this interview with me, because it sort of kills two birds with one stone. Because first of all, congratulations on your engagement to my nephew. We have got to know each other very well, and so I wanted to work on that, get to know a little bit about you and about what you do. I know you're a nurse, so that interested me. And to see what your background, just a little bit about your background and where you're from. And
I have my bachelor's degree in nursing. I live in Eastern Kentucky, and I'm an emergency room nurse, which takes a lot of patience, literally. I love my job. It's challenging, but it's very rewarding. Been a nurse for about 3 years now. I see a lot of things in the emergency room.
I can imagine.
Yeah.
Well, I am just starting a MSW program at Southern Adventist University, studying social work, and hopefully will someday be a clinician. That's what my focus is on, family and children.
Yeah.
But again, it's challenging. I'm just learning.
I'm sure. I know. I see a lot. You know, I work a lot with social work in my field, and I know that takes a lot of patience as well. And it's.
Now, what did you? What's your? So you're an emergency room nurse.
Yeah.
Do you see a lot of mental health patients there? Or?
At least on a daily basis. Most of the time, what we see is a lot of depression, suicidal patients. It's challenging sometimes though, because I have to deal with the physical aspect of that patient priority. If they've come in and they have tried to hurt themselves, you know, I have to take care of their physical need, and then we deal with the psychosocial needs that they have. And we always consult a social worker, and they come in and will evaluate the patient and determine if they need placement. The only, kind of sad thing is that our hospital that I'm at doesn't offer any kind of mental health program. So we usually have to ship patients outside facilities.
Okay.
And there's a lot of rules, and I'm sure you're aware, it's hard to place patients sometimes. And that's frustrating as a nurse, because you want to help that part of their needs, and they don't always meet the criteria, even though they may have a true mental health issue.
What kind of, how do you best relate to those people? What do you find that's most helpful in relating to your patients when they come in, whether it's physical needs or?
I think that number one, it's just about good communication. I try to tell my patients everything ahead of time. I have to take myself to their level. If I'm talking with someone who may be of a low socioeconomic status, I have to come down to their level. I have to explain things maybe in a more general standpoint versus if I'm talking to, say, another physician or someone else in the hospital, in the department. You have to know your audience. You have to communicate with them and show empathy and care and understanding of what they're going through, because, when you're sick or when you're, anytime, that's a scary place to be, and you have to be understanding and be there for that patient.
It's interesting. Empathy is the number one word, I think, in both of our jobs. The job that I do now, and I'm studying.
And you have to be open-minded, you may not always believe 100% what your client or your patient's telling you, but you have to have that open mind to say, okay, if this is my facts, and to get all those facts, you have to be educated and aware of what's going on, to help them.
Now, I know that in Eastern Kentucky, I know there is a huge drug problem there.
Oh, yeah.
And what helps you to deal with those issues? Because I'm sure you see a lot of them.
We do, and I'm not going to lie or anything, but they do come in and they will say they're having these kind of symptoms simply to get, supposed narcotics or things like that. And that's difficult, because regardless if you think that's the issue, you have to treat that symptom. If they're telling you they're having chest pain, you treat it as is. And that's frustrating for me as a nurse, because a lot of times it takes me away from the patients who really do need my care.
Right.
And then you deal with the frustration that we don't have adequate, rehab or any kind of those facilities around to help the patients.
So you have to send them further away from the
and that's very difficult. If they don't have then you deal with insurance. Insurances a lot of times won't pay for those kind of needs. So it's a bad cycle that you keep seeing.
Yeah, I'm just curious, just being a student again now, did you have any specialized training in mental health while you were studying to be a nurse?
For my bachelor's degree, you have an entire semester of mental health nursing. You do a clinical setting, different places. Sometimes they're state hospitals, sometimes they're local facilities. I actually did one at a place in Lexington, Kentucky that was great. It had from child up to adulthood, covered all kinds of different, settings, from drug addiction to true mental health, other disorders, schizophrenia, those kind of things.
Okay.
So I felt really prepared.
Okay, that's good. So you feel comfortable in communicating with those people
Yeah.
when they come to the hospital?
It's kind of nerve-wracking sometimes, I guess, for lack of a better word, because you don't, until you've been in their shoes, you may not always know what that's like. But the only thing that I keep reminding myself is just to be open-minded and understanding, and care for that patient.
Yeah.
Caring is that's why I'm a nurse, that's what I do.
And you seem to me like you have those characteristics that are valuable in what you do and in what I do. So, especially genuineness, you have to show that, and that's it.
And it's all about interdepartmental relationship. We communicate. Communication is the biggest part of our job between patients, clients, and other departments and fields.
That's interesting. We have a lot in common.
Yeah.
We have a lot more in common than I thought. But so on a personal note, how did you meet Timothy?
High school sweethearts.
Oh, okay.
Kinda.
Well, I guess I remember that.
Yeah.
Okay.
Been together a while. It's about time.
Okay. Good. Congratulations.
Well, thank you. Thanks for choosing me for your interview.
Thank you for doing it.